Why can't my mom be weaned off the ventilator in ICU? Ventilator liberation strategies. My name is Patrik Hutzel from IntensivCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care. Making sure your loved one always gets best care and treatment. So today I have a question from one of our clients, Janine, who says, "Hi, Patrik. My mum keeps failing the pressure support, so I suggested to speak with the pulmonologist and ICU doctors to give her something else. I reiterate that her heartbeat is different, plus she has the lung cancer. Maybe that's how it is, as long as it's not dangerous. They place her on Buspar to see how she reacts to it. They will also try pressure support when I'm there. She was tolerating it before, so I don't understand why not now. Can you please let me know why my mom can't be weaned off the ventilator? I really don't want my mom to spend the rest of her life on a machine. That's not fair to someone who loves to laugh, talk, eat, etc. Nor do I want her to spend the rest of her days in ICU. Our goal is to, at last, be on something if she has to, like a CPAP or a tracheostomy. Thank you for your help." From Janine. Janine, thank you so much for your question. You're asking why your mom can't be weaned off the ventilator, especially since she was tolerating pressure support before, but keeps failing it now. You've mentioned her heart rhythm is different. She has lung cancer, and understandably, you don't want her spending the rest of her life on a machine or in ICU. Let me walk you through what might be happening here and also offer some solutions. So, why ventilation weaning might fail. First off, when someone keeps failing pressure support trials, there are usually multiple factors at play. Pressure support is a weaning mode where the ventilator provides assistance when your mom takes a breath, but she has to initiate each breath herself. If she's failing these trials repeatedly, the ICU team needs to dig deeper into why. Common reasons for failed weaning attempts include underlying lung disease progression. In your mom's case, the lung cancer should be affecting her respiratory mechanics and gas exchange. Cardiac issues, you mentioned her heart rhythm is different and cardiac function is absolutely critical for successful ventilation weaning. Heart failure, arrhythmias, or coronary issues can prevent weaning even when the lungs are ready. Respiratory muscle weakness, prolonged ventilation causes diaphragm atrophy, and this atrophy sometimes is also called ventilator-induced diaphragmatic dysfunction. Anxiety and agitation, which is interesting because they're trying the Buspar, which is also known as Buspirone, for your mom. Anxiety dramatically increases oxygen consumption and can sabotage weaning attempts. Fluid overload, too much fluid in the lungs makes breathing harder and weaning nearly impossible. Nutritional status, malnutrition, or electrolyte imbalances affect respiratory muscle strength as well. Infection or inflammation, pneumonia, sepsis, or other infections prevent successful liberation from the ventilator. The fact that your mum was tolerating pressure support before but isn't now suggests something has changed. This could be disease progression, a new complication, further cancer growth, inadequate treatment of underlying issues, or even the weaning approach itself. Lastly, she's probably still on too much sedation or opiates, right? And that's why you need to get access to the medical records right now. And that's why you need a consulting session, because the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So let's look at why the heart rhythm matters. You mentioned your mom's heart rhythm is different. This is actually really important and often overlooked. The cardiovascular system and respiratory system work together intimately. When someone is on a ventilator, positive pressure breathing actually helps the heart pump blood. When you try to wean them off, suddenly the heart has to work much harder. If your mom has underlying cardiac dysfunction, whether it's heart failure, coronary artery disease, arrhythmias such as atrial fibrillation, or heart valve problems, her heart might not be able to handle the increased workload during weaning trials. This is called weaning-induced cardiac failure, and it's a common but frequently missed reason for failed extubation. The ICU team should be evaluating your mom's cardiac function thoroughly. This might include echocardiograms or ultrasound, checking cardiac biomarkers like BNP, troponin, optimizing fluid status, and potentially adjusting cardiac medications. She needs input from a cardiologist, full stop. Next, the lung cancer factor. Having lung cancer adds another layer of complexity to ventilation weaning. Depending on the type, location, and extent of the cancer, it can cause airway obstruction, reduce functional lung tissue, cause pleural effusions, fluids around the lungs, or lead to post-obstructive pneumonia. The ICU team and pulmonologists need to assess whether the lung cancer is stable, progressing, or potentially treatable in a way that could improve respiratory function. Sometimes palliative radiation or other interventions can help improve breathing, even in advanced cancer. Why Buspar makes sense and what else might help? It's good they're trying Buspar for your mom. Anxiety is a massive barrier to ventilator weaning. When patients are anxious, they breathe rapidly and shallowly, consume more oxygen, and work their respiratory muscles inefficiently. This creates a vicious cycle that makes weaning almost impossible. Buspar is a non-sedating, anti-anxiety medication, which is smart because traditional sedatives like benzodiazepines or propofol, ketamine, or Precedex actually worsen delirium and prolong ventilation. However, Buspar takes time to work, usually several days to weeks, so this isn't a quick fix either. Other strategies that help with ventilation weaning include aggressive mobilization, physical therapy, optimizing pain control without over-sedation, so that means it's a very fine line, treating any underlying delirium, ensuring adequate sleep, and having family present during weaning trials for reassurance. The importance of timing and trying pressure support when you're there. It's actually really insightful that they're planning to try pressure support when you're there. Family presence can make a huge difference. Your mum will likely be calmer, more cooperative, and better able to handle the stress of a weaning trial when you're at the bedside providing reassurance. This also gives you the opportunity to observe exactly what's happening during the trial. Does she become anxious? Does her heart rate or blood pressure change dramatically? Does she look uncomfortable or distressed? Can she still tolerate the breathing tube in her mouth? These observations are incredibly valuable. So, what questions should you be asking? Here's number one, why having access to all medical records becomes absolutely critical. You need to see the complete picture, all the test results, imaging, consultation notes, daily progress notes from doctors, nurses, physios, and so forth. Without this information, you're making decisions in the dark. Questions you need answers to: what specific parameters is she failing during pressure support trials? Is it respiratory rate, oxygen saturation, heart rate, blood pressure, comfort? Is it tidal volumes, minute volumes, and so forth? What does her chest X-ray show? What does her arterial blood gases show? Is there fluid overload, pneumonia, or worsening lung cancer? What do her cardiac studies show? Has she had recent echocardiogram or ultrasound? What does her blood work show? Are there electrolyte imbalances, sign of infection, or nutritional deficiencies? Is she opening her bowels? Is she absorbing her feeds, etc.? What is her sedation and pain medication regimen? Could medications be contributing to respiratory depression? Has she had a swallow evaluation? Aspiration can cause recurrent pneumonia and prevent weaning. What is the pulmonologist's specific weaning plan? Is there a structured protocol, or are they just trying things? Have they considered a tracheostomy as part of a longer-term weaning strategy? And this is exactly where a consulting call with me or one of my team members will make all the difference. We review all the medical records, identify what's being missed, help you formulate the right questions, and even participate in a call with the ICU team to advocate for your mom, clarify treatment plans, and change the dynamics in your favor. Too often families are given vague answers like she's not ready or we're doing our best, but that's not good enough. You deserve specific detailed explanations about what's preventing weaning and what the concrete plan is to address each barrier. We can question and advocate on your behalf, pushing the ICU team to optimize every modifiable factor: cardiac function, fluid status, nutrition, anxiety management, sedation, mobilization, and more. Sometimes having an independent critical care expert review the case reveals missed opportunities or alternative approaches the ICU team hasn't considered. Let's look at the tracheostomy question. I know the word tracheostomy sounds scary, but here's the reality. If your mom continues to fail weaning attempts and requires prolonged ventilation, tracheostomy might actually be the best path towards getting her off the ventilator eventually. A tracheostomy offers several advantages. It's more comfortable than an endotracheal tube, allows for better oral care and potentially eating, drinking, reduces sedation requirements, makes weaning trials easier, reduces dead space, the air in the breathing tube, and facilitates transfer to potentially a step-down ICU eventually for controlled weaning or to go home with intensive care at home. Many patients who get tracheostomies are successfully weaned and decannulated, which is the tracheostomy tube being removed over time. It's not necessarily a permanent situation. Now, here's something really important that most ICU teams don't discuss. Go and check out intensivecareathome.com because we offer a long-term option that keep your mom out of ICU predictably and permanently if she needs long-term ventilation and or tracheostomy. You mentioned you don't want your mom in ICU long-term, and I completely understand that. The thought of someone who loves to laugh, talk, and eat being warehoused in a facility for the rest of her life is absolutely heartbreaking. Intensive Care at Home provides private duty nursing with ventilator expertise right in your home with intensive care nurses 24 hours a day, all the equipment and supplies needed for home mechanical ventilation, ongoing medical management by doctors and 24-hour intensive care nursing, experience in home ventilation, a care plan focused on quality of life, not just survival, and the dignity and comfort of being at home with family. Many patients on long-term ventilation with or without tracheostomy, whether through tracheostomy or non-invasive ventilation, like BiPAP, CPAP, can live at home with proper support, 24-hour intensive care nurses. This allows your mom to be in familiar surroundings, maintain her personality and interests as much as possible, and have meaningful time with family. Some patients even continue weaning efforts at home with a structured weaning program. Sometimes the ICU environment itself, the noise, constant interruptions, lack of sleep, anxiety prevents weaning, and patients do better in the calm, familiar environment. Let's also look at alternative ventilation options, CPAP, BiPAP, and high flow. You mentioned your goal is to at least get her on something like CPAP or a cannula if she has to be on support long term. This is absolutely reasonable, and there are several intermediate options between full mechanical ventilation and room air, which is non-invasive ventilation like BiPAP or CPAP, can be used for many hours a day or just at night, supports the work of breathing without a tube in the throat, and can be used at home indefinitely as well. High flow nasal cannula delivers heated, humidified oxygen at high flow rates, is comfortable and well tolerated, and provides some positive airway pressure support. Nighttime only ventilation, where some patients only need support while sleeping and can breathe independently during the day. The key question is whether your mom's respiratory failure is reversible or if she has chronic respiratory insufficiency that will require ongoing support. Her lung cancer and cardiac issues suggest she might need some level of support long term, but that doesn't mean full-time invasive ventilation next. So what needs to happen next? Comprehensive cardiac evaluation, pulmonary assessment, respiratory assessment, optimized fluid management, aggressive delirium and anxiety management. A good day and night rhythm helps as well. Structured weaning protocol, physical therapy and mobilization, and nutritional optimization, as well as family involvement, and then look at intensive care at home if need be. Get on a consulting call with me ASAP. Go to intensivecarehotline.com. Call me on one of the numbers on the top of our website or send me an email to support@intensivecarehotline.com and go and check out intensivecareathome.com as well for long-term ventilation options at home. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care.